This is the last part of our Rickettsia, Coxiella, and Bartonella lecture. And in this lecture, we're going to focus on the organism Bartonella. Now, I just want to be clear that Bartonella is not part of the Rickettsiaceae family or the Anaplasmataceae family. Bartonella, like Rickettsia, like Coxiella, like Anaplasma, is a gram-negative rod. It is a bacteria. However, like the rickettsial organisms, this organism can have an insect vector as a host, and it's very different than our typical gram-negative rods that we've discussed previously. So that's why Bartonella is being discussed with this group of organisms, even though it is not part of the Rickettsia group of organism. So one of the Bartonella organisms is Bartonella bacilliformis, and this is one of the Bartonella organisms that's transmitted through a vector, and in this case the vector is the sandfly. So Bartonella bacilliformis infections are much more common in South America. I already said they're gram-negative rods, and they are poorly staining, just like all of the gram-negative rods within this lecture that we've discussed. None of them stain well with gram stains. Bartonella bacilliformis causes lymphadenopathy and hepatosplenomegaly, and it causes skin lesions that will develop into these little nodules or tumor-like masses that have an ulcerated surface. Another Bartonella organism is Bartonella quintana, and it's one of the causes of Bartonellosis. Bartonella hanseli, which we're going to talk about next, also causes Bartonellosis. Now, Bartonella quintana is transmitted by the louse vector. So we've already talked about the louse or lice in plural. So what Bartonella quintana can cause is bacteremia, endocarditis, and bacillary angiomatosis. Now, bacillary angiomatosis is caused when new blood vessels form in the skin or the organs, and it's much more common in HIV-infected patients. Now, Bartonella quintana is considered a febrile systemic infection. Now we're going to talk about some other Bartonella organisms, and these organisms cause the disease cat scratch disease. So there are Bartonella organisms that cause cat scratch disease. There are 18 different species that cause diverse symptoms in individuals that are infected. So there are numerous genus and species that cause cat scratch disease, but we are going to focus only on Bartonella hanseli. So the Bartonella hanseli is the causative agent of cat scratch disease, and this is a more recently identified infection. It was identified in 1983, and there are about 25,000 cases every year in the United States. And of course, like the disease name implies, cat scratch disease, you get infected through exposure to infected felines. So if you get bitten or scratched by an infected cat, you can get cat scratch disease or Bartonella hanseli infection. So what it does is it causes an acute flu-like symptom, fever, muscle aches, not eating, or anorexia, and it's usually self-limiting in about 6 to 12 weeks. So for quite some time, you're not feeling all that great. What happens is a lesion will usually develop several days after being bitten or scratched by an infected cat, and then around that area of infection, you will get a swollen lymph node about 1 to 2 weeks after that lesion develops. So the epidemiology is usually through cat bites or scratches. a lot of kittens can carry Bartonella hanseli. So normally the most common transmission is in cats that are less than 1 year of age. It's much more common in kittens that are infested with fleas, and you can have transmission from one cat to another through the cat flea. So that's why it's much more common in kittens and cats that have fleas. And the majority of cat scratch disease cases that occur happen in children. So the common scenario would be a parent buys their child a nice brand new little kitten, cute little kitten, and the kitten is feisty and, not meaning to hurt the child, but scratches the child or gives the child a little nip. And unknowingly, because the kitten is completely asymptomatic, the kitten is carrying Bartonella hanseli and then infects the child. So here is how cat scratch disease commonly develops. So you could see the little lesion on this small boy's face right near his nose and mouth, a little pustule lesion, and then his neck, that lymph node in the neck region right near where the infection site is, gets very swollen. So that's typical cat scratch disease symptomology. Here again, you have a lesion where this individual was either scratched or bitten, and then you get the lymph nodes that swell up. So Bartonella can be cultured. So unlike Coxiella and Ehrlichia and Rickettsia that cannot grow in artificial media, Bartonella can grow in artificial media. However, it is very, very difficult to grow. It requires special media. It is not an organism that would commonly be identified using your typical artificial media in a clinical microbiology laboratory. So it's more often going to be diagnosed by symptoms. You have a parent that brings their child in, and 2 days, a week before, they bought their child a kitten and he was scratched and had a lesion, and now he's got these massive swollen lymph nodes. So immediately, cat scratch disease would be ruled out, and it would be diagnosed usually through some type of immunological based test, such as immunofluorescence or another serological based test. So I said you can actually grow Bartonella on artificial media, but it's very difficult to grow. So it's not an organism you're going to likely see in a clinical laboratory. But it does grow. So Bartonella is a little different than the other organisms in this lecture because the other organisms can only grow in live cells, whereas Bartonella does not have to grow only in live cells. But like all the other organisms in this lecture, it is a small gram-negative rod. Now, treatment for cat scratch disease, usually it's self-limiting, but antibiotics will treat it, gentamicin and ciprofloxacin, so it's not that big of a deal. And it's easily prevented by treating infected cats and kittens, vaccinating cats and kittens, as well as adequate flea control. And so I'm ending the lecture with pictures of my two cats. The orange cat is Beasley and the white cat is Lulu. And I just want to emphasize that for this lecture, what's very important is which organism causes which disease, the differences among the symptoms of these diseases, especially the rash, so where that rash is located, what type of rash, and also the vector, which vectors, which diseases are transmitted through the tick, through the mite, through the louse, through the flea. So, all that you should memorize for the next exam as well as for your final exam. Don't forget your final exam. The final exam is cumulative, so all of the material is fair game for the final.